Yeah, good day everyone. In our last session, we started demo on what is medical coding, what is ICD coding, and what is CPT coding, and what is the requirement of the medical coder to sustain as a good coder. Okay. In today's class, we will know. We will. I try to manage the. Try to tell what is the anatomy requirements in the coding. Coding. What is the importance of the I- anatomy? Importance of anatomy and what is the ICD? ICD, yeah, nomenclature, which is used to represent disease. Disease with ICD, with ICD 10. Okay, 10 cm. Okay, yeah, it is important to know know what is the human anatomy, how the body planes will be represented, what is prefixes, suffixes before a word, and what is the anatomical variations and all these things. Okay. In the CPT book, in CPTD updated 2025 book, we will have the illustrated anatomical and procedural review. Okay, it will give an idea of vocabulary. What is the vocabulary the doctor may use to represent the diseases and as well as the procedures. What are the procedural terms, prefixes, suffixes? What is he doing? What the procedure he is doing? Like that, we will have an idea by checking the illustrated anatomical and procedural reviews in ICD CPT book. Okay, I am right now reading the step-by-step process in using CPT book. If you have available updated CPT book, you can go through that along with that listening to the what I'm saying. Okay. It is essential that coders have a thorough understanding of the medical terminology and anatomy to code accurately. Okay, the follow section reviewing the basics of vocabulary and anatomy can be used as a quick reference to help you with your coding. It is not intended as a replacement for up-to-date medical dictionaries or anatomical tests, which are essential tools for accurate coding. What they are saying? It is essential that coders have a thorough understanding of the medical terminology and anatomy to be coded accurately. What it means? You have to learn the anatomy, what is the basic vocabulary, and anatomy can be used as kick. And this page, the continuous page, though it is about 2-3 days, just two two pages only in CPTP. Yeah, stating that prefixes, suffixes, and roots and numbers, surgical procedures, conditions, suffix, meaning, and examples. Okay, prefix, suffix, and directions and positions, and words and meanings. Okay, it is a 2-page section. In that, they will give you an idea what is vocabulary, prefixes, suffixes, and roots. In the prefixes, suffixes, and roots, although medical terminology may seem complex, many medical terms can be broken into component parts, which makes them easier to understand. Many of these terms are derived from Latin or Greek words, but some include the names of physicians. Yeah, what are the prefixes, suffixes, and roots? The medical term may seem complex. Many medical terms can be broken into component parts. What component parts? Prefixes, suffixes, and roots. These are derived from Latin and Greek words, but some include names of physicians. There may be some name of the physicians who first defined that term or something. Okay, like that. Prefixes are word parts that appear at the beginning of a word and modify its meaning. Prefixes are word parts that appear at the beginning of a word and modify its meaning. What is prefix? It will be at the start of the word. Suffixes are found at the end of the words. The suffixes means it is at the end part of the word. By learning what various prefixes and suffixes mean, it is possible to decipher the meaning of a word quickly. The terms will be used by the doctors in documenting the procedures or diseases. We have to understand what the suffixes and prefixes and roots. Roots will be very important in ICD-10 PCS, which is used in the inpatient coding to report the procedures. In outpatient coding, we will use CPT, current procedural terminology. But in inpatient coding, they will use the ICD-10 PCS. What is PCS? Procedural coding system. Coding system for inpatient reporting. Inpatient reporting is different, outpatient is different. In our case, as a surgery coder, we are focusing on outpatient. Okay, outpatient procedural coding system. Outpatient coding, in which we use ICD for diagnosis, CPT for procedures, along with modifiers. Okay, modifiers. Here, in those, the doctor will dictate all the document, all the medical terminology and what are the services through some vocabulary, medical vocabulary. To understand the what the doctor is telling and all these things, we have to learn the anatomy. Anatomy, anatomy and prefixes, suffixes, prefix, suffix and roots. Okay. Yeah. Here prefix is before the starting. For example, mono. Mono means one. Monolithiasis. Monolithiasis means theasis. Means what is the meaning of monolithiasis? It is single stone. Single or one stone. Lithiasis means stone formation. Okay. Or monocyte. One cell. Like that. Unilateral. Unilateral means one-sided. Unilateral chest pain. Unilateral chest pain. Chest pain in one side only. Okay. Like that, we have to understand what are prefixes. What are the other prefixes? Prefixes by. What is by? Two. What are the examples? Bilateral. Right and left. Okay. If you are there telling bilateral knee pain, right and left pain. Okay. Bilateral knee pain. The pain is in both. Pain is in both the knees. Next, if they tell that doctor will not document like that, the pain is in right knee, left knee, not like that. Not like that. That the patient may come up with the doctor document will detail like that. The patient has bilateral knee pain due to osteoarthritis. That's it. We have to code bilateral osteoarthritis. Okay. Don't expect the doctor to tell right and left that osteoarthritis. They will document like that bilateral osteoarthritis of the knee. We have to code bilateral OA of knee. That's it. Whatever the whatever M code is my M code will come. Whatever the musculoskeletal codes. Okay. M series codes. Yeah. Yeah. What are other things? Try. Same. It is pertaining to referring to 3. What means 4? 4. Quadrilateral, bilateral, triad, like that. Quadrilateral, quadriplegia. Quadriplegia means plegia in 4 or limbs. Plegia in all 4 limbs. Right to left, right and left to left, left arms, left hands, and all these things. Quadra. Exa. Next one. X. Exa. Exa means 6. Diplo. Next one. Diplo. You will find most of the words like this only. Diplo means double. Diplopia. You will find a word like diplopia. What it means? Double vision. Okay. We have to learn the prefixes like this to know meaning. I mean, it is a starting point of a word. Okay, when the doctor is documenting. If you find any kind of this like document prefixes, you have to understand what the doctor is telling. Exa meanings. Diplo means double, like that. What are the suffixes? Suffixes, those are the words at the end of the word. End of medical word, can I say? Okay. It is basically it will come up with procedures only. Okay. In case of surgeries, it will come with the synthesis. You will refer the what is meant by synthesis. Okay. Synthesis means puncture of a cavity, puncture of a cavity to remove fluid. Amniocentesis. Amniocentesis means puncture the amniotic cavity to derive the fluid, amniotic fluid. Okay. It is the suffix. It will place a small dots before that. For suffix, it was after a word. Okay. There was a word before the word. If it is once amniocentesis, it will be the amniocentesis. Okay. Like that. Ectomy. Ectomy means removal. Removal or excision. Appendectomy. Surgical removal of the appendix. Ostomy. Ostomy is a new permanent opening. Colostomy. Ostomy. New permanent opening. Colostomy. For suppose colostomy. What is colostomy? Creating a opening in the colon to remove the colonic stool or something. Okay. Not exactly the definition. We have to check the definition. What is the meaning? Colostomy, making an artificial opening. Otomy means opening into, cutting into, incision like that. Incision, tracheotomy, For example, porphy, AAPC. Or for a AAPC. You have to learn the prefixes and suffixes. AAPC means fixing, surgical fixation, oplasty, otoplasty like that. Rhinoplasty. Example is rhinoplasty, surgical repair of the nose. Lithotripsy. Lithotripsy. Lithotripsy means crushing or destroying stones. These are the suffixes used for the surgical procedures. For surgical procedures. These were all documented in that CPD book at the start of the current CP Code Procedural Terminology book, CPD book 2015-25. You can check that and read thoroughly to get a grasp of all the terms. What is ectomy, what is synthesis, what is ostomy, what is otomy, what is ovary, what are ovexy, what oplasty. These are suffixes at the end of the procedural terms. Okay, by knowing these meanings, you have to get to know what the doctor is documenting, what the procedure they are doing. It is very crucial in surgery parts. Okay, just don't just remember. Yeah, in suffixes it is diagnosis parts. It will be different meaning. Suffixes in conditions or diagnosis. There is a different meaning. The prefixes or suffixes both are suffix and prefix are different in conditions, diagnosis. Yambi, anesio, dis, hetero, homo, hyper, hypo, iso, mal, megalo, and algia suffixes. Algia, asthenia, emia, iasis, itis, litis, lytic, word, oma, opathy, orogia, oria, oasis, parasis, plasia, plegia, and pnea. There are certain meanings to that suffixes, the prefixes, and as in the diagnosis parts also, and the surgical procedures, they have suffixes for meaning different. Suffixes is suffix in the procedural terms will be the procedure, what the procedure done. What type of the procedure, either excision, ectomy, ostomy, otomy, oraphy, opexy, oplasty, otripsy. In the prefix section, it will be different condition. Yambi means both. Aniso means unequal. Dis means bad, painful, difficult. You good, normal. Hetero, different. Homo, hyper. Homo means same. Hyper, excessive. Hypo means deficient, below. ISO, you will get to know that most of the terms are hyper, hypo, ISO, megalo, yambi, dysfunctional, dysphoria. These are the examples we can check in the book also. Suffix means algia. In the conditions, algia means pain, asthenia, weakness, emia, blood, iasis, condition, itis, inflammation. This is the most used term. Whenever we find a suffix itis means it is an inflammation of the body part. Appendicitis. What is the meaning of appendicitis? It is the inflammation of the appendix. Lysis means destruction, breakdown. Hemolysis, breakdown of the blood cells. Hemolysis. Hemolytic means lytic means destroy, breakdown. Same, almost same. Lipoid means like. Oma means tumor. Carcinoma means cancer. Opathy means disease of arthropathy. This is condition of the bones. Arthropathy. Menorrhagia means hemorrhage. Menorrhagia means excessive menstrual cycle, like that meaning. Chorea, flow of discharge. Amenorrhea, nothing. Amenorrhea, like conditions. Oocyst means abnormal condition. Tuberculosis, paralysis, hemiparalysis, plasia, growth, hyperplasia, plegia, paralysis, paraplegia, apnea, breathing. We have to learn the prefixes, suffixes in the diagnosis parts and surgical procedures for suffixes. What are the procedures done on the anatomical parts? Okay, endocentesis, ectomy, ostomy, otomy, orphy, opexy, oplasty, otripsy. There are certain meanings pertaining to that suffixes and suffixes. We have to get to know that everything was understood. What are the doctor documented? We have to understand what they are trying to tell. Okay, by knowing the what are the meanings of the suffixes and prefixes, we will get to know exactly what the doctor is telling. Okay, yeah, on the next page is about directions and positions. And direction means positions. Direction. So if it is the doctor will like that. I abducted the leg. Like they will document. Abducted means away from. Adducted means adduction means toward. Ecto means outside. Ectopic exocrine. Endo within endoscope. Epi upon. Epigastric. Infra below under. Ipsi same. Meso middle. Meta after beyond transformation. Peri surrounding. Retro behind. Across through. We have to know the directions and positional terms. AB means away from. AD means toward. Abduction means the leg was abducted means it was turned away from the midline. Adduction means turning the leg towards the middle. Okay. Ecto means outside, ectopic, exocrine. Endo means within, endoscope. Endoscope means the doctor will place the scope through one of the opening, either nose, oropharynx, if through anus or something. What are the you have some openings, natural openings for the body. No? We have nose, ears, anus, rectum, like that. It is the endoscope only. Epigastric. Infra means below, under, infrastructure. Ipsi means same. Ipsilateral means same side. The opposite of that ipsi, contralateral. Opposite side, contra. Mesofixy, middle of the, fixing the in the middle. Meta means after, beyond transformation. Metastasis means the cancer progressed to beyond the after, beyond the origin. The cancer was metastasized to some organ, other organ. Okay, peri means surrounding, pericardium. Pericardium means the cardiac muscle. Retro means behind, retroversion. Trans means across, transvaginal, through the vagina, meaning. Also, and the word meanings anterior, ventral, posterior, dorsal, superior, inferior, lateral, distal, proximal, medial, supine, prone, sagittal, transverse, and canal. These are the very important terms with respect to the procedures. We have to understand how they are doing. When the doctor documented anterior means he is doing the procedure from front part of the body. Okay, at the near the front surface of the body. Posterior means at the near the back surface of the body. They are doing the patient from the back side of the body. Superior means above. Inferior means below. Lateral means side. Lateral means side, away from the midline. Distal means farthest from the center. Center to distance part. Okay. Distal. Proximal means nearest to center. Medial means middle. Supine face up or palm up. Prone means face down or palm down. These are the sagittal, transverse, coronal, very important. Sagittal means vertical body plane, divides the body into equal right and left. It is the midpoint. It divides the body into right and left. Transverse means top and bottom. Okay. Horizontal body plane divides the body into top and bottom sections. Coronal means vertical body plane divides the body into front and back, interior, posterior. It will come from the body center point. It will divide the body to front, back. Transverse means top, bottom. Sagittal means vertical body plane. It will divide the body into two parts, right and left. That's it. We have to get thorough knowledge of all these prefixes and suffixes. It will be in the start of the CPT book. Okay. Now, today we are so what are we have discussed about importance of anatomy. Anatomy is very important in surgical coding, outpatient and as well as inpatient coding, and what are the terms used by the doctors in diagnosis parts. Okay, prefixes, suffixes, and roots. And suffixes at the end of the word. They were both used in procedural terms and as well as diagnosis terms. Okay. In diagnosis also, there are some prefixes and suffixes. All are in CPT at the starting. We have to read them thoroughly to learn the coding. Why I'm not sharing here the CPT or something, CPT book? It is a copyrighted version. Even the AMA will not allow sharing of in the public domain. Okay, they are copyright protected. Okay, AMA CPT. AMA will monitor the CPT procedural terminology and they have rights, copyrights. So that we are not supposed to share on a public domain. So that we have to be careful that we don't share it on a public domain. Okay. Whenever I'm sharing a CPT code, I will be sharing suffixing, prefixing some words or something, or some typomation. Only short forms of that CPT descriptions will be shared like that only. Okay, please make a note of it. In further classes, we will be starting what are the ICD guidelines and what is the ICD guidelines we have to follow for ICD, ICD reporting, ICD reporting, diagnosis reporting. Okay, what are the guiding diagnosis, how to follow ICD guidelines, and what are the ICD guidelines, AMS, ICD-CM. Okay, we have to learn the ICD reporting. Okay, for diagnosis. Okay, that's all for today. In later classes, we will get to know the what is ICD coding, and we will also discuss what are the suffixes, prefixes, and all the examples if needed by going the through ICD guidelines and ICD. What is ICD? How to search for the ICD in the coding books. Okay, that's all for that for this day. Okay.